Hello guys and welcome back to my channel. My name is Jessica. I am here sharing my journey with hidradenitis suppurativa, or as I like to call it, HS, as well as my journey with motherhood and navigating all things in life. So today I wanted to share a bunch of the different treatments that I have tried so far for my HS. One thing that I have learned is that HS treatments is not a one size fits all. There are so many treatments that work for so many people, and there's treatments that don't work for people. So I want to share everything that I have tried to maybe inspire you to bring up something to your doctors or dermatologist that you could possibly do to help treat your HS. And maybe we can all kind of bounce ideas off of each other while we deal with this awful illness. So keep in mind, I was diagnosed with HS back when I was 12. I am 29 years old now, so this is everything that we've done in those 17 years to treat my HS. When I first got diagnosed with hidradenitis suppurativa, there was no research, no treatments available for me at the time. So it was literally just trial and error amongst me and my dermatologist. So if you did not watch my last video, I talk about how when I started getting HS, I got it right here at the top of my chest. I was 12, so I was still at a pediatrician's office. My pediatrician recommended me to go to a dermatologist, and so that's kind of how all this started. I had the most amazing dermatologist at Kaiser. She just retired. I no longer have Kaiser, so I'm okay that she's retired now. And she was very passionate about HS and research for it. So we've kind of tried a lot of things over the years. So one of the first things we actually started trying, and I actually had a lot of facial acne, so we did 2 different rounds of Accutane for my HS at the time, and it really cleared up my face like a lot. And it did work for my HS, but as soon as I got off of that medication, I had HS again. So while I was on Accutane, I did not have any flare-ups, so we felt like it was successful. It did put me into remission for like a little bit after stopping Accutane, but overall, Accutane didn't work for me. But like I said, what might work for me or didn't work for me might work for you. So we did 2 different rounds of Accutane. Another thing that we tried at the time was she took the spots right here in my chest and she cut them out and then cauterized them. And I am not somebody who likes needles, procedures. I have a lot of anxiety when it comes to that. I struggle with that. And so that was like one thing that we tried. It was really scary for me. I remember the smell of like the cauterizing because I was awake for this procedure. Nothing hurt. I didn't feel anything but like pressure, but I just remember the smell. Obviously that didn't work because I still struggled with all these spots right here in my chest. Other things we've tried, clindamycin orally, taking clindamycin pills, and then also there's a cream or there is like a bottle of clindamycin solution that you can use. So I do use that on my spots. It has not helped, but I wonder, you know, I've been using that since I was 12. Do you become immune to things after so much time? So one of the big things with HS is antibiotics do help with like the inflammatory part of HS, but it will not cure your HS. And so clindamycin just wasn't something that had ever worked for me. I had this done twice. I had 2 different gland removal surgeries. I would say the first one was successful. So the first one I had right down the middle between my breasts. You would think that I had some sort of like chest heart surgery when I had it done. It was not a painful recovery. If you have HS, it hurts. It hurts so bad. And I've always said like my C-sections, I had 2 C-sections with both my kids, and that recovery was literally a walk in the park compared to some of the pain that I deal with daily with my HS. So I had 2 different gland removals. I had the first one between my chest, and then a couple years later I had it done on the inside of both of my breasts as well. I would say the one down the middle of my chest was a success. I do not get HS there anymore. I don't know if it was a mix of like having the gland removal there and having a bunch of spots cauterized, or just, I don't know what changed in that area. But the ones on the inside of my breast, I only get flare-ups there when I am nursing. So since I'm no longer nursing and I'm not postpartum anymore, I no longer get them right there. So like my big flare-up spots right now are my armpits, my thighs, and my groin. And none of those spots I have had gland removal surgery done. We have tried long-term antibiotics, which destroyed my stomach. and I'm not somebody who's good with like yogurts and probiotic things. So that was really hard on my stomach. At the same time we did long-term antibiotics, we also tried spironolactone, and that just, I got like some sort of stomach infection around this time that we started doing the long-term antibiotics and spironolactone together. And I had to stop taking both the medications to allow my stomach to heal. And so we don't really know if that ever would have worked out. We never went back down that route of trying long-term antibiotics and spironolactone or just trying them separately. We never just went back to that. Another big thing that we do, I wouldn't say this is necessarily a treatment, but we do lance them and drain them when they get really bad. And it's really hard to get, at least for me, a dermatology appointment. So sometimes I have to get these done in the ER, and it's awful. It's literally awful. I have a lot of scar tissue from all the HS, so it's really hard for them to numb the area. So 9 times out of 10, when they perform a lancing, I feel every single thing. And it is traumatizing. It gives me major anxiety when it comes to the medical world, but I continuously go back because as soon as you drain your HS, it feels 90 times better than it did, 5 minutes before that. So I've had them where we've lanced and drained them and left them unpacked. I've also had them where we have to pack and unpack the wounds constantly. And so I've had one where I went to Kaiser like every day for almost 2 months straight, and I got a staph infection from that. So there are pluses and minuses to lancing and draining them or packing and unpacking them. I've always found that the packing, unpacking, it allows it to heal. It takes longer to heal, but I feel like I don't get a flare up as quickly. Whereas if you just like lance it and drain it and then just leave it be, it kind of sucks. My next like phase of treatment I am going to start though is called Cosentyx, hopefully. And that is a biologic medication, and it basically, so when you have HS, your immune system is overactive, I think is what they said. Like it's too much. I cannot fight it. I can't fight the inflammation. I can't fight anything. My body is like attacking itself. So this biologic helps do that. And this is a lifelong medication I would have to be on. There's also Humira. You could do Humira as well. My doctor is leaning more towards Cosentyx because it's more like for HS, where Humira kind of does like a lot more. The downsides is, one, I'm on this medication probably for the rest of my life. And 2, it's an immune suppressant. So there's a chance that I'm more likely to get sick more often, which is hard as a mom. But we're exploring 2 options. So we're exploring for myself, for my next phase of treatment, trying to figure out my HS, is Cosentyx or going and doing a really big surgery in my armpits. And we have a consultation this week, and I'm a little nervous about it, but we have a consultation this week to kind of talk about what that surgery would look like moving forward and what that recovery is. If you don't know, I'm a mom of 2. My daughter is almost 4 and my son is 1.5. Or my son is almost 1.5, and so I have little babies at home that need their mom. My son needs to be held. He can't climb into his crib and out of his crib. He can't get in and out of his high chair. So I'm curious to see like, what does that recovery look like for me and my family, because my kids come first to me. And I know my health should be important, but also being able to hold my babies and snuggle my babies and be there for my babies is also something that is really important to me as well. I feel like I have tried a lot of things for my HS, and I don't know what else I could try yet. You guys have a ton of amazing suggestions within my Instagram comments as well. But as of right now, this is everything that we have tried for HS and what has not worked for me. But like I said in the beginning of this video, what didn't work for me is something that probably could work for you. So I highly recommend talking to your dermatologist to see what options you have out there. Living with a chronic illness is not easy, but since sharing my journey, I found this amazing community of people to lean on and vent to and explore other treatment options. And thank you guys so much for watching, and I look forward to continuously sharing this journey with you.